Hi guys, my name is Dr. Haroon. I am a cosmetic doctor who specializes in non-surgical aesthetic treatments. Today we'll be discussing one of the most popular non-surgical aesthetic treatments. Of course, I'm talking about Botox. We'll be discussing some of the most common areas that Botox are carried out, what you can expect from this treatment, how long they last, and generally any other important facts that you might want to know before having this treatment done. Let's get into it. Firstly, let's talk about what Botox is. Botox is a temporary muscle relaxant. If this is the muscle, this is the nerve, Botox will sit in the middle and stop the nerve from working against the muscle. Therefore, it relaxes the muscle, and in certain areas, it can soften lines and wrinkles. Botox has been used cosmetically for over 30 years, and the three most common areas that it's used is in the frown area, the forehead area, and around the eyes. Let's look at each one of these areas and see what the benefits are. In the frown area, it can be used to soften the vertical frown lines that we can see when we make an angry appearance. In the forehead area, it can be used to soften the horizontal lines that appear when we raise our eyebrows. And around the eyes, it can help soften the oblique lines that appear when we squint or when we smile. So, what can you expect on the day of treatment? Botox is administered using a tiny needle injected just under the skin in all of these areas. On the day, there might be some redness, some swelling, and occasionally a little bit of bruising. The most important thing to mention is that Botox does not work straight away. On the day, you will have zero cosmetic effects from Botox treatments. Over the next 24 hours, any redness or swelling will start to settle, but you will still see no cosmetic results from this treatment. The first signs of anything happening in these areas is around day 3, and most people start experiencing some benefits around day 5 to 7. The final result is always at 2 weeks. And for most people, the cosmetic effects of this area will last anywhere between 3 to 5 months. Sometimes a little bit longer, sometimes a little bit less. It really just comes down to your metabolism. If it's your first time having this treatment, it's important to mention that over the first 2 weeks, you might experience some strange sensations in these areas. One of them being forehead heaviness. This is because the Botox relaxes the muscles, therefore when you try and raise your eyebrows, it feels restricted, or it can feel like someone is pressing their finger down against your eyebrows. This is quite normal, and it usually resolves at the 2-week point. Something else that might occur in the first 2 weeks is mild headaches. If this were to occur, it usually happens for around a few days, and it will resolve after that. These headaches are mild and can be described as tension headaches. Most people would describe them as mild headaches, and they almost always resolve at the 2-week mark. Going back to the way that Botox works, if it is relaxing the muscle, it is therefore minimizing the amount that it contracts, and therefore it softens lines and wrinkles. It's important to say that if the lines are already quite deep and pre-existing, Botox might not completely get rid of those. These lines are called static lines, and it's where the wrinkle has now gone into the skin. Botox will still help with these lines, however, it usually doesn't completely eradicate them after the first round of treatment. There is some good news. Even if the lines are static and deep, and they are there at rest, over multiple sessions and multiple courses of Botox over the span of a year, maybe a year and a half, even these lines start to fade and can disappear. The biggest improvement that you're going to see with Botox in these areas is the improvement of dynamic lines. Dynamic lines appear when you contract a certain muscle. For example, when I raise my eyebrows, you can see some fairly deep lines and wrinkles. these are dynamic lines. However, when I rest and relax, you can still see a few lines and wrinkles that are there at rest. These are static lines and these are dynamic lines. Botox does help both of them, but you see a bigger improvement in the dynamic lines. There are a few secondary benefits of having Botox treatment in these areas as well. And one of the ones that people experience is the improvement in the quality of the skin and improvement in any acne. The reason that this happens is that Botox also minimizes the secretion or the release of sebum, which is an oil that is released onto the surface of the skin. The fact that the levels of sebum have been lowered on the surface of the skin can improve the quality of the skin and give a nice glow in the areas. So just to summarize, Botox is a temporary muscle relaxant. The most common areas that it's used cosmetically is to improve the appearance of lines and wrinkles in the frown area, horizontal forehead lines, and the lines that appear around the eye called crow's feet. It doesn't work straight away. It takes 2 weeks to see the final result, and for most people, the results last for anywhere between 3 to 5 months. If you want to find out more about Botox in and of itself, how it works and what other areas you can treat, and maybe what are the differences between Botox, dermal fillers and skin boosters, you can check out my other video where we go into a lot more detail about these topics. I hope you've enjoyed the video today, guys. If you have any questions regarding this particular treatment or any other treatments, please get into contact. Thanks a lot, guys. Bye now.